Good morning. I'm Julie DeSimone. I'm the program officer for the Mayor's Wellness Campaign at the New Jersey Healthcare Quality Institute. Thanks for joining us this morning. Before we get started, I just want to go over a couple of housekeeping items. All the phone lines are going to be muted for the duration of the program just to limit our background noise. The webinar will be recorded and posted on our website after the presentation if you need to refer back to it. And you can ask questions by typing into the chat box, and we'll have time to answer them at the end if I'm not able to answer them in real time. Okay, so in today's presentation, we're going to do a brief overview of the Quality Institute and our community health initiatives. And by the end of the presentation, you'll learn about the benefits to utilizing volunteers to support your Mayor's Wellness Campaign program, strategies for engaging volunteers in the community, and tips for successfully managing volunteer efforts. Okay, so a quick overview of the Quality Institute, just to give you a sense of who we are as an organization. We're a multi-stakeholder nonprofit organization, and we believe that collaboration is essential to improving our healthcare system. So we convene healthcare leaders throughout the state around the common goal of improving the safety, quality, and affordability of healthcare for everyone. And so our work falls into four main buckets: quality improvement, policy, education, and then community health. At the Quality Institute, we have two main community health initiatives. So the first is our Mayor's Wellness Campaign, which obviously we're going to cover in depth today. And the second is called Conversation of Your Life, also known as COIL. COIL aims to change the culture in New Jersey around advanced care planning. COIL provides evidence-based tools and strategies for residents, caregivers, and healthcare providers to discuss and document their wishes about the treatment they wish to receive in case of a medical emergency or serious illness that leave them unable to speak for themselves. COIL has developed a community conversation around the kind of care that New Jersey residents want to receive and how residents can plan for a medical emergency or serious illness. So this is done through the support of volunteer-based task forces in 15 counties across the state. So those counties include Atlantic, Bergen, Burlington, Camden, Essex, Gloucester, Hudson, Hunterdon, Mercer, Middlesex, Monmouth, Morris, Ocean, Somerset, and Union counties. And COIL provides educational community events throughout the year. Events can include panel presentations, book reads, film screenings, and are largely facilitated by volunteers on those task forces that I mentioned. And like many other organizations this year, these events have been hosted on virtual platforms. Incorporating COIL programming into your Mayor's Wellness Campaign is a great way to bring this important conversation to your community. And so if you're interested in getting connected to a local task force, you can let me know. And if you're in one of the counties where we don't have a formal task force, we still have people who are working on these efforts in those communities. So feel free to reach out. Okay, so our Mayor's Wellness Campaign, which hopefully you're all familiar with, is our statewide community health initiative, which is in partnership with the New Jersey State League of Municipalities. We provide evidence-based tools and guidance to mayors and community leaders to help residents achieve a more healthy, active lifestyle and to improve the health and wellness of your communities. With the Mayor's Wellness Campaign, mayors have the platform and tools they need to make their community a healthier place to live, work, and play. We currently have 419 participating communities, and we're adding more each year. If your town is not already participating in the Mayor's Wellness Campaign, there's plenty of reasons why you should join. Participating communities receive support and guidance from our Mayor's Wellness Campaign staff to organize a local Mayor's Wellness Campaign committee and identify your top local health needs. Throughout the year, Quality Institute staff works with communities to review your local health data, identify needs, and plan and implement appropriate programming and policies. Access to our Mayor's Wellness Campaign Toolkit and the Mayor's Wellness Campaign Handbook are a great reason to be part of the program as well. The Handbook is a really great tool for towns looking to start up a program or reinvigorate what's already happening. It provides a step-by-step instruction on program development and walks you through how to utilize the Mayor's Wellness Campaign staff to support your programming. Both of those tools can be found on our website. We also can provide connections to local partners to future your campaign goals and find volunteers for your events. Quality Institute has over 100 member organizations as partners, and we're always looking for ways to connect health systems and providers to the community. We encourage you to share updates on your campaign with the Quality Institute because we're always trying to highlight all of the great work that you're doing in your community. Mayor's Wellness Campaign towns have access to networking opportunities with other Mayor's Wellness Campaign participants to share your activities and learn from others. This year, we were able to hold 21 focus groups throughout the state, one in each county, and it was a great opportunity for towns to hear from their neighbors about their pandemic response efforts and think about best practices that they could implement in their own town. You'll also have access to our Quality Institute events. This year, we were able to offer monthly webinars featuring our partners from across the state, largely focused on the pandemic and COVID response. Towns will also receive information about grants and funding opportunity for your program. This year, through our virtual campaign, we're able to award 3 towns with $1,000 each to put towards their Mayor's Wellness Campaign programs in their communities, and we hope to be able to continue those efforts. And finally, communities that participate in the Mayor's Wellness Campaign are invited to apply annually for our Healthy Town designation. We'll talk a little bit more about that. So the Healthy Town designation is an opportunity for towns to be recognized for all the work that you're doing. It really aims to highlight communities in which mayors have made healthy lifestyles a top priority and are actively engaging all members of your community through inclusive and evidence-based health and wellness programming, policies, and a culture of health. Healthy Town designations are a great honor achieved through a competitive process annually. This year, we recognize programming may have looked slightly different, and we were able to adjust the application to account for that and allow towns to share how they use their Mayor's Wellness Campaign to respond to the crisis and the changing needs of its residents. I always like to remind towns that achieving the designation is an ongoing process and should be integrated into your annual programming. The rubric that we use to score the application is always available on our website and serves as a great planning tool. By using the rubric throughout the year, you can ensure that you're prepared to submit the strongest application. The application opens in November of each year and is due at the end of January. And you can always reach out to me throughout the year to help you work on your application on an ongoing basis. The designation allows towns to receive recognition for all of your hard work that the community has put in the last calendar year and celebrate those successes with your residents. Healthy Town designees receive a sign for your town hall or municipal complex. You're featured in the Quality Institute website and promoted in the media through press releases and a widespread social media campaign. We also highlight the winners in our newsletter, which goes out to over 1,000 government and industry community leaders across New Jersey, and you'll be featured in an article for the New Jersey State League of Municipalities magazine. We also invite Healthy Town designees to present in our webinars and community events throughout the year. It's a great way not only to highlight the work in your community, but to create partnerships across the state. Okay, so that was a quick overview of our programs at the Quality Institute. And so now we're going to get into talking about volunteers. Volunteers are an integral part of the local Mayor's Wellness campaigns throughout the state. And without their input, the program would not be nearly as successful as it is. And I just want to start out by pointing out that Mayor's Wellness campaigns utilize a few different types of volunteers. The first are members of the Mayor's Wellness Campaign Committee. And so as you hopefully know, one of our first recommendations for the program startup is to create a Mayor's Wellness Campaign Committee. It's important to invite a variety of diverse community members to serve on these committees. I do think it's best practice to have a municipal employee as the chairperson for the committee, and this provides a direct line to the municipality and hopefully to your mayor. It can also make it easier to get through some of the bureaucratic barriers to getting programs off the ground. And even if a town is able to dedicate staff time to Mayor's Wellness Campaign, those employees are often wearing multiple hats and will need more support. And that's why we really recommend building a diverse committee made up of various stakeholders from your community. Some of the people that you may want to include at the table are individuals from your local health department or health board, representatives from your schools, senior centers or recreation department, gym or yoga studio owners or instructors, local restaurant owners or chefs, physicians, dietitians and nurses, social workers, clergy, librarians, and any active and involved resident. So as you can tell, there's really no wrong answer to who should be at the table. But it's important to be mindful that, especially when it comes to municipal employees, some of these folks might be what I like to call voluntold to be part of the committee. So don't overestimate their capacity to participate. The next type of volunteer are long-term volunteers. So these might include engaged community members who are consistently part of your Mayor's Wellness Campaign programming and events. They're often involved in the planning and facilitation of your activities, but might not sit on your actual committee. And finally, you might need short-term volunteers for one-time or particularly large events or programs. So some of the strategies that we discussed today are going to be more appropriate for your committee members and long-term volunteers than your short-term ones. Okay, so we're going to talk about some of the benefits to utilizing volunteers. And the first is that we know, like I mentioned earlier, that most of our Mayor's Wellness campaigns have either limited or no funding dedicated to the program. And so in these situations, volunteers are truly the only thing that keeps these programs going. Many municipalities do not have the financial resources to fund positions to support the Mayor's Wellness campaign. And those municipal staff that are working on the Mayor's Wellness campaign programs are usually doing that in addition to their regular responsibilities. And volunteers provide added support that keep programs running. Volunteers can provide administrative support by helping to plan the logistics of events, reaching out to partners and advertise programs, and conducting program evaluation and follow-up once the programs have ended. They can also be used to staff larger events such as community walks or a food pantry. And when municipal staff time is limited, volunteers can expand the capacity of the program. Okay, so secondly, inviting volunteers to the table really allows you to strengthen your program with the ability to offer specialized classes and activities from experts in your community. The Mayor's Wellness Campaign always recommends inviting partners to serve on your committee. And as I mentioned earlier, those local business owners and health experts are going to be really important for this. And don't think about volunteers as just, manpower, but also by what skills or opportunities they bring to the table. For example, if you're asking a volunteer from a local school, you're more likely to be able to offer programs to the kids in your community because they already have those connections and relationships in the school. If you have a yoga studio or a local nutritionist at the table, they'll be more willing to offer their services as part of your program. It is also helpful if those businesses are able to offer prizes or incentives for participating in programs that your Mayor's Wellness Campaign might not have the funds to purchase. Rather than just soliciting donations, include those businesses in the program development and as part of the planning process. The community benefits from free yoga classes or nutrition education, while the local businesses benefit from being able to advertise their services and get their name out in the community. So the final and arguably most important benefit of engaging volunteers is that it expands your community engagement, which is key to the success of the program. One of the things that I really love about the Mayor's Wellness Campaign is that we recognize that no two communities in New Jersey are the same. The program encourages you to do what makes the most sense for your local community. And the best way to really understand what your community needs is by bringing those members of your community to the planning table. By seeking out volunteers from local places of worship, community groups such as Rotary clubs, and your town's general population, you'll get that real community feedback that's needed to make your program successful. It's also important that your Mayor's Wellness Campaign committee reflects the community that you're trying to serve. Unfortunately, COVID-19 has further highlighted what we already knew, and that that communities of color and other vulnerable populations have a higher risk of experiencing poor health outcomes. It's important to consider these health disparities when developing your Mayor's Wellness Campaign goals throughout the year. By having individuals that represent minority groups at the table and that reflect your community, you'll have a better success in reaching those residents. Another often forgotten benefit of volunteering is the benefit to the actual volunteers themselves. And so volunteering has been shown to have so many positive outcomes for the people who are participating. It can reduce the risk of depression, create a sense of purpose, and helps individuals stay mentally and physically active, which are really important, especially right now, given our increased isolation and lack of community involvement. It also can give people a sense of purpose and teach valuable skills. And it helps people to make connections in the community and develop new relationships. And like I mentioned, this is just something that's even more important given the current situation. I'm going to talk a little bit more about this later when we discuss a new volunteer-based program that we're launching next month. Okay, so now we're going to talk a little bit about how to actually find quality volunteers in your community. In many cases, when we attempt to recruit volunteers, we really don't know what it is we need them for. And so it's really important to be strategic about your recruitment strategy rather than just bringing people on for the sake of expanding your group. Think about the 3 types of volunteers that we talked about earlier. So which type you're looking for will really change your outreach strategy. And it's also important to let the potential volunteer know upfront what it is you're looking for. Someone may be interested in helping out at a one-time event, but not interested in sitting on a committee that meets regularly. Similarly, it's important to identify what your needs are and then set out to find individuals who can meet those needs, the same way that you would do if you were hiring staff. This helps to get people on board, and people are more likely to sign on and then stay engaged when they have clear expectations of what they'll be doing. Your current committee members and volunteers are your best advocates and recruiters. So encourage your volunteers to share their experiences of being part of the Mayor's Wellness Campaign and ask others to join them. You can also post volunteer opportunities just as you would a job posting on a community forum or social media, and as well as in community spaces such as libraries, grocery stores, and places of worship. There's also online databases such as Volunteermatch that help connect people who want to volunteer to local opportunities. So you can post a description of the work that you need volunteers to do, and they can reach out based on their interest. The Quality Institute also has a relationship with the New Jersey Action Coalition, and we can help get you connected to volunteer nurses who are looking to work in their local communities. So this is a great opportunity if you're looking for help with a health screening or a clinic or community education. So you can always reach out to me and get connected to those local nurses. I also think it's a missed opportunity if you're not reaching out to the young people in your community. First of all, students always have requirements for community service, so they're usually looking for opportunities to get involved, and they can also be great for those one-time larger events. But I think more importantly, the Mayor's Wellness Campaign program is built with the goal of improving health and wellness in the community and creating that culture of health. And I really don't think there's a better way to create healthy lifestyles and habits than by embedding those ideas in our kids at a young age. I think by exposing them to community organizing, you give them the opportunity to want to contribute and be involved in their community. And by teaching them how to live healthy and active lives, you're more likely to have them engage in those healthy behaviors going forward. And additionally, by allowing kids to share their ideas and be part of the planning process, you're more likely to develop programs that are going to appeal to the younger generation in your community. And finally, don't think of recruitment as a one-time event. We talked about the different types of volunteers, and it's true that if you have a big program coming up or a community event, you may need to solicit volunteers for those one-time events. But I think it's important to use your programs throughout the year to engage interested volunteers and always be thinking about how you can grow the strongest committee and group of volunteers. Okay, so we're going to talk about some tips for making your volunteer efforts as effective as possible. And so I'm going to preface this with saying that I completely understand that some of, depending on the size and capacity of your Mayor's Wellness Campaign, some of these strategies might feel a little bit out of reach, but I still think it's worth going over and encourage you to implement as many as you can. Oftentimes we make the mistake of taking anyone who will volunteer because we figure that they're, kind of free labor. And I think that this can be a mistake. It's worth taking the time to interview or at least have a conversation with potential volunteers before agreeing to take them on. It's just as important that someone that you are not paying is a good fit as it would be for a paid position. So in some instances, generalized help might be needed for those large community events. You may need people to hand out water or check people in at registration. But for smaller or more specific activities, you might need to verify that the volunteer has the skill set that you're looking for. And again, I can't stress enough that by setting those expectations, you're more likely you have a positive experience as well as your volunteer. And those conversations ahead of time give you the opportunity to set expectations and get on the same page as your volunteers. As we discussed earlier, it's important that as volunteers come to the table, you and the volunteer both understand the goal for your involvement. If both sides have agreed upon expectations, it's more likely that you'll get what you need from the volunteer and that the volunteer is going to have a positive experience and therefore want to continue working with your group. Just because the volunteers are unpaid does not mean that they shouldn't be managed and have a chain of command in place. Volunteers need to know who they're reporting to, who they can go to if there's an issue, and whether or not they're responsible for managing other volunteers. And again, by laying all of that out ahead of time, you're going to reduce any conflict that might arise. While you might not have a formal evaluation process in place, it's important to let volunteers know how things are going, especially if there's a concern. If volunteers aren't meeting expectations, be sure to address it with them directly so that they can make adjustments and continue the work, or worst case, consider that it might not be a good fit. If volunteers are mostly helping out at events, it's a good idea to debrief after those events. It gives you the opportunity to discuss what went well and what could be improved for the next event. It also is important to solicit feedback from your volunteers. Allowing them to provide insight about their experience not only gives you the opportunity to improve your program or process, but it also gives the volunteers a sense of feeling valued. And we're going to talk a little bit more about that on the next slide. So a lot of times volunteers are not valued in the way that they should be, which can lead to them becoming unengaged. A 2019 study reported that the value of volunteer time is about $25 an hour. And so when you consider this value to your Mayor's Wellness campaign, it makes the case for investing more time in your volunteers and their contribution to the work. All of these things that we discussed on the previous slide are ways to do that throughout the process. Even though they might feel like a heavy lift, I do think it's worth the investment up front. So it can also be nice to set aside time to formally recognize your volunteers and all of the work that they're doing. While annual events like a volunteer recognition breakfast, for example, can be a nice way to do that, it's also important to remember that recognition should not only happen once a year. Consider highlighting your volunteers on your social media platforms or in community newsletters. And you can also invite them to your town council meetings or other community events to celebrate the work they've done, especially after a successful event. Okay. So this year we offered a new way to highlight the work of your volunteers. During these particularly challenging times, we wanted to provide an opportunity to recognize someone in your town that you consider to be a Mayor's Wellness Campaign champion of health. And so we asked mayors to nominate someone who was active in the health and wellness activities of their community and someone who's passionate about improving the lives of residents. This year's winner was Allison Serco. She's the community outreach manager at Hackensack Meridian Health. She was nominated by Mayor John Moore from the city of Asbury Park. And her dual role as an employee in a local health system and on the Mayor's Wellness Campaign Committee enabled her to leverage these important resources from the hospital and get them to residents in her community. She increased access to healthcare by bringing mobile health clinics and screenings to residents for those who weren't able to get to the hospital. And she also invited providers to share their knowledge with the residents through community education. And so we had so many impressive nominations this year that we will definitely be making this an annual award, and you'll be able to submit those nominations in the fall as a small way to recognize those volunteers. Okay, so I wanted to point out some ways that towns have utilized their Mayor's Wellness Campaign volunteers to impact their communities this year. It's worth mentioning that some of our Mayor's Wellness Campaign towns run their programs completely on volunteers. Like I mentioned earlier, I do think it's important to have buy-in from the municipality. So I love to see mayors dedicating staff time to the program as needed, but in some cases that's just not possible, and volunteers really are the heart of the programs. More commonly, volunteers work in conjunction with municipal employees to bring programs to the community. Throughout the last year, we saw a lot of towns responding to food insecurity because of the pandemic. And so towns created volunteer-based food pantries to respond to that food insecurity. They also mobilized to deliver groceries to older adults who are too high risk to do their own grocery shopping. So volunteers were reaching out to those older adults. They were getting those shopping lists, going out and actually doing all of the food shopping for them and then delivering them to their home. And this was a completely volunteer-run program that really kept those high-risk, vulnerable populations out of the grocery stores when the crisis was really at its height. We also saw volunteers from local high schools sewing masks across the state. That was a popular activity in many towns. And so they were sewing those masks for hospital staffs and first responders to be able to use to protect themselves against the pandemic. And this was even more important at the beginning when PPE was an issue. And so in addition to these volunteer movements that have emerged in response to the pandemic, we saw volunteers across the state donating their time to continue to provide their kind of regular Mayor's Wellness Campaign programming, health education, physical education classes, or support for community events that create a reprieve from the increased social isolation that we've all faced this year. So I mentioned earlier that we have a resource in the works that is built on volunteers. When we asked community leaders back in April during those focus groups that I mentioned, what their top concerns were regarding the pandemic, we heard over and over again that they were worried about older adults in the community and who were experiencing increased social isolation. And so in response, with the support of a mayor group, we've created a toolkit designed to provide towns with a step-by-step instruction on how to create a volunteer-based program to match older adults with someone to help them maintain those social connections. And so the toolkit will walk you through all of the components needed to develop, implement, and evaluate the program. It has tools for the volunteers, including a resource guide and a conversation starter guide. And this program is going to be piloted in Passaic County starting in March, but eventually we will roll this out to the statewide. So I encourage you guys to keep an eye out for that and consider implementing something similar in your program. We're hoping that it's going to be a useful tool for towns to utilize volunteers and addressing those needs in your community. Okay, so just as a review, so we talked about volunteers and how they support unfunded programs, they increase your areas of expertise and engage the community. I really want to encourage you to be purposeful and diversify your strategies for volunteer recruitment. It really can make the difference of whether you're creating long-lasting volunteer groups that are going to stick with you through your programming. And volunteers need the same structure as paid employees. And again, I do recognize that capacity can be an issue here and you're not always going to have the time to devote to this volunteer management. But I think to the extent that you can prioritize it, it really does make a difference. And show your appreciation when you can. I think that those one-time events are great. Be able to do a nice breakfast if that's something that is feasible for you, but there's other ways. And I think the strategies that we talked about by opening those lines of communication, providing opportunities for for volunteers to provide feedback is a great way to show that you value your volunteers as well. Okay, so we have some questions in the chat already. You can continue to send those in if you have them. The first question is, how can we continue to recruit and engage volunteers amid the COVID pandemic and other competing priorities, school and work? So yeah, that's a good question. I think, we've heard a lot about keeping volunteers safe during this time. And I think it really depends on the type of program that you're running. We've seen a lot of towns throughout the state this year move their programs to a virtual platform. So those same experts that we talked about, whether it's the yoga instructor or the nutritionist providing those free programs for the communities, those can be moved to a virtual platform if people are worried about staying safe and maintaining those social distance. But as the warmer weather comes back, hopefully we'll see towns move their programs to the outdoors. There's also a lot of that support that people can do behind the scenes if they're not comfortable being out in the community and engaging. A lot of that administrative work, whether it's collecting those donations, whether it's helping to provide the outreach to get people involved in your program. So I think the same way that we've moved, our professional lives to a virtual platform or continue to follow the guidelines to keep people safe, we can do that with our volunteers as well. Okay. So mentioned the social isolation toolkit. Are there any other resources that we can share with our mayor's wellness committees for recruiting volunteers that cover some of the tips you mentioned, or will these slides be available? So the slides will definitely be available. We'll put them up on the website along with the recording for this, but we always have tools available on our website. So the one that I really would recommend everybody take a look at would be our Mayor's Wellness Campaign Handbook. That's something that we launched this past March. And like I mentioned, it is a really comprehensive step-by-step guide of how to get your program up and running or how to enhance your program if you already have one. It walks you through the main steps of creating a program, which starts with, having your mayor sign that annual pledge of participation, and then creating that committee that we talked about. It lists all of the suggestions that we mentioned today about who you might want to invite to your committee and have them at the table, and then really walks you through what I consider to be the most important step, which is identifying those local needs. You really want to make sure that the programs that you're creating are addressing the needs in your local community. And so the handbook is a great tool for that. It provides resources and data sources for you to do that local needs assessment and make some great suggestions on how you can engage your community. And it also gives you touch points for when it when you can reach out to the Mayor's Wellness Campaign staff to assist you with your programming. Okay, so Mayor's Wellness Campaign Committee in South Plainfield is hosting an event. Oh, I think you just want to let us know that there's an event in South Plainfield on the 25th. So thank you for sharing that. Do we find that volunteer recognition correlates to higher retention rates? Yes, so definitely. I think all of those things that we talked about, again, I know some of them feel like a heavy lift. It's almost like having a staff person that you have to manage. But I do think, we talked about that $25 an hour value. When you look at it that way, it really is worth putting that time in. And the more volunteers that you have that stay in it for the long run, the less time you're going to have to spend training or, reintroducing people to programs. And the more that you can make them feel like valued members of the team, both in that structure that you're providing, but also the nice, feel good recognition, you will see more retention there. How can interested community partners learn more about active Mayor's Wellness campaigns throughout the state? That's a great question. So all of our towns are listed on the website. I really encourage you to follow us on our social media. We have a really active social media campaign that lets you know not only what we at the Quality Institute are doing throughout the year, but also what our partners are doing. And like I mentioned earlier, if those of you who are running programs throughout the state, let us know. Send me an email. Send us, tag us on your social media campaign. Your social media platforms. And that way we can share that work with other people. The more that we can kind of get the word out, the better. And it gives towns ideas without having to reinvent the wheel. We also do send out a quarterly newsletter, which hopefully you're receiving. And if not, feel free to contact me and let me know. That's a great opportunity for us to share what we're doing at the Quality Institute, but we also like to highlight the towns that have submitted some of those program ideas. And we've, especially during the pandemic, when people are looking for new ideas to implement in their communities, we've found that to be a really easy way to do that. With most community centers being closed due to the pandemic, it's posed an obstacle to recruiting volunteers. Do you have any tips or strategies for communicating with residents about volunteer opportunities? Yeah, so I think this is something we've all had to adjust to no matter what type of program or work we're doing. We find that social media works really well. I know a lot of communities throughout the state have started doing more frequent posting, whether it be videos or just posts through Facebook. So that's a great place to use those online platforms to recruit people. I also mentioned the Volunteermatch.com. This is just a general kind of volunteer search engine, but it allows people to search for opportunities in their local community. So definitely check that out. You can put in very specific information about what you're looking for, and then volunteers can seek you out based on their interest. So that's a good way to do that online. And again, word of mouth. I mentioned that your current volunteers are your best recruiters. So always encouraging them to keep their eye open for people who are interested in participating. Okay. Any Mayor's Wellness Campaign events that you can share with your communities that are coming up. So the next webinar that we'll be hosting will be to roll out that toolkit that I mentioned. So you'll be receiving information from me about that as far as attending those. But again, following us on social media is a great way we don't always send out individualized emails about community events that our local Mayor's Wellness campaigns are hosting, but we do like to share that information on our social media or in the newsletter. So make sure that if you're not receiving those newsletters, let me know and I'll get you on the list, and follow us on our social media campaigns. Okay. If there's any other last minute questions, feel free to type those in. I also just want to say a quick thank you to all of our 2020-2021 Mayor's Wellness Campaign sponsors. So without their partnership, the work of the Mayor's Wellness Campaign would not be possible. And a special thank you to our platinum level sponsors. Let's see. Okay, someone asked about the name of our Facebook page. It's just the Quality Institute. So it's the New Jersey Healthcare Quality Institute. I know Dapa's on. He can tell me if yeah, Dapa's gonna tell you the right handle so that I don't mess you up. But it's all under the Quality Institute, not specifically the Mayor's Wellness Campaign. So thanks for pointing that out, actually. All right. And if there's no other last minute questions, my contact information is up on the screen here. You guys are always welcome to reach out. And we will, yeah, sure. So someone had asked about emailing the link to the slides. We will email the slides as well as a copy of the recording if needed afterwards. And thanks for participating today, and look forward to hearing from you if you need any assistance with your volunteer program.